If there's a house fire and the firefighters show up and they put out the fire, but then there's some water damage, if you blame the firefighters for the water damage, it's like blaming cholesterol for heart disease. It's going to show up when there's been damage to the vessel wall. So it's involved in heart disease, but it's very short-sighted to say that it's the fault of cholesterol that we have damage and that we have the beginning stages of heart disease.
Welcome to Hack to Health, where we share hacks to help you live younger, longer. I'm Joe Steele, and today we're blowing the lid off of everything you thought you knew about heart health with Angie Gallagher, a national board-certified functional medicine health coach with over 25 years in cardiac rehab. If you got normal cholesterol, don't get too comfortable. Angie's here to reveal why that number is lying to you and what's actually driving your heart risk. From shocking truths about what your doctor isn't testing to practical science-based hacks you can start today, this episode will flip your approach to heart health upside down. If you're ready to uncover the secrets your blood work's hiding, let's dive in. 2.5 decades in cardiac rehab. So what are we, quote unquote, being misled about?
Blaming cholesterol for heart disease. So I like to use the analogy, if there's a house fire and the firefighters show up and they put out the fire, but then there's some water damage, if you blame the firefighters for the water damage, it's like blaming cholesterol for heart disease. Cholesterol shows up because it's a repair agent. So it's going to show up when there's been damage to the vessel wall. And so it's involved in heart disease, but it's very short-sighted to say that it's cholesterol. It's the fault of cholesterol that we have damage and that we have the beginning stages of heart disease. So we need cholesterol. I think that's the other thing is people think, oh, the lower the better, just put me on that statin and get the cholesterol down so I don't have another heart attack. But cholesterol is needed in the body in so many different ways. So to blame it is just, it's just wrong and very short-sighted. But I think the reason that it's blamed is because there's an allopathic cure for it, right? So the pharmaceutical industry wants us to believe that it's cholesterol because they've got the statins to lower it.
And for people who may not understand, what is the benefit of cholesterol and how does it aid us in the body?
Without cholesterol, there is no life. Cholesterol is involved in the membrane of every cell of the body. It's involved in lining of the nerves in the body. It's involved in creating hormones, which obviously we all need. It's involved in creating bile for being able to absorb fat-soluble vitamins. So there's just so many, and it's involved in fighting infection, and it's involved in all of that.
When maybe, our parents were little, correct me if I'm wrong, but I think it was like 300 was considered above that was high, and now it's like 200, and
they keep
almost like the
driving it down.
What is that about? Is that the pharmaceutical?
Honestly, I think a lot of the studies are being sponsored by pharmaceutical industry, and so now they're saying LDL should be below 70. Well, you better take that statin to get that LDL down. So I just think that we really need to be careful who's doing the research, who's interpreting the research, and what do they stand to gain?
I actually had one person told me they were friends with, he was a cardiologist or an MD, and he thinks everyone should be on statins.
Yeah.
Everyone, just preventive.
Cardiologist.
And it's like, oh my gosh, like what in the world is that going to do to everyone? Who knows? And obviously the naysayers will say there's some benefit, but the merry-go-round of cardiovascular disease and you come in to assist. So can you break down what that means, conventional medicine, and why patients are still kind of stuck in this merry-go-round?
I'm so glad I'm not working in that field anymore. 25 years working in cardiac rehab. And in the beginning, I thought, I was doing good work and making a difference for people and changing lives. But after being there long enough, I started seeing that people were coming back. And I was like, we're teaching them all the right things. Their risk factors are seemingly under control. Why are they back? Why did they have a second heart attack? Why did they have a second stent placed? Why are they now in cardiac rehab for the third time? And this time it was after bypass surgery. Like, what are we missing? And in many cases, their doctors are just telling them that they are just genetically predisposed, and this is just going to be the way it is for them. It's just bad genes. And I was like, there has to be more to the story. There has to be something else that we're missing. So I started diving deep and going down rabbit holes and learning about functional medicine and realizing there's There's all these other factors at play. And so I went back to school. I was actually counseled for 2 hours by a functional medicine doctor in the area. And she told me about all this stuff, blew my mind, about the connection between the gut and the heart and the nervous system and all these other factors that we weren't taught at all. And so I went back to school, got certified as a functional medicine health coach, started implementing what I learned in cardiac rehab, got a couple of the patients in cardiac rehab to work with the functional medicine doctor that I actually started working with as the coach. And they got off the merry-go-round. The ones that started working with functional medicine got off the merry-go-round. No more heart issues. I was still trying to work with some of the people in cardiac rehab to teach them the same concepts, and I ultimately got fired for it. It just didn't jive with what the Western medicine dietitians were teaching. They were upset that I was teaching things that were kind of counter to what they were teaching, as far as it's okay to have some eggs for breakfast instead of a big bowl of oatmeal, because you're not exercising enough to burn off that big bowl of oatmeal. And the eggs are, a great protein source. And they were like, oh no, what is she teaching them?
You brought up a good point with genetics, and you do hear that a lot. You hear people all the time. Your grandfather had this, your father had that, so therefore you're going to get that. What is your belief when it comes to genetics? Does it play any role, a bigger role than they're making it seem to be, or?
I do believe genetics plays a role, but what we have learned in the functional medicine space, and you probably know this, that genes load the gun, environment pulls the trigger. So I think it's, who was it that coined that term? Mark Hyman coined that term. So we can be predisposed to things, but it's the environment that washes over those genes, whether those genes are going to express or not. And even if the genes do get expressed, there's still many things that we can do within our day-to-day lifestyle to minimize risk. So we need to be looking at all those other root cause factors for heart disease. And sure, we may have genetic predisposition, but let's look at the environment that our genes are being exposed to.
Do you think it's mainly environment that we can't get a handle on this heart disease epidemic?
Yeah, I think stress is huge. I think there's a lot of money being spent to influence us in what we eat. The processed food industry is also just, they are spending billions of dollars to get us hooked on processed foods. People are stressed. They're coping with stress by eating, by drinking. And stress is probably the hardest. There's really no pill teach us to better manage stress or to change the way stress affects our bodies. So people are stressed, they're short on time, they're eating a lot of processed foods, and and we need to be aware, like you said, it's still the number one cause of death and disability. 50% of people who will be diagnosed with heart disease will be diagnosed by having sudden death. I mean, that's staggering. You don't
huge.
even know that there's anything going on, and you can have sudden death. So, and it's affecting people, people a lot of times think, oh, well, it's just affecting, old people, like, oh, it's just an old person's disease. 50% of men who are going to have a cardiac event will have it before the age of 65. So
I remember the show, Biggest Loser, like that guy, Bob, if he had a heart attack, right? It can happen to anyone. That guy
had people in cardiac rehab in their 40s. Yeah. I actually had a 38-year-old that had a heart attack when I was in cardiac rehab. I had triathletes in cardiac rehab. I had a triathlete that had open heart, bypass surgery. I had a 50-year-old woman who was a runner. It is not biased toward. Of course, if you're overweight and sedentary and have terrible lifestyle factors, you're going to be more at risk. But you could look like the picture of health and not know you have heart disease brewing.
Yeah, because that's more what I was asking. Like, is it that we can't get a hold of the stress, a diet, lack of exercise, the ultra-processed foods? People who are sedentary in their life, what do you think it is that, they can't seem to get a handle, though? Is it the messaging is not out there by design? Like, the money's in the medicine, right? So therefore, there's no motivation? Yeah,
I mean, we really don't have a lot of, calls to action for people to do the things in their life that no one makes money off of. It's like you see all the commercials on TV. I mean, everything is about money and, people managing their stress through breathwork. that doesn't really make anybody a lot of money. I mean, I would love to promote my friend who teaches breathwork courses, and she's amazing. And if anyone's interested, I'm happy to share her information. But there's not a big industry, for breathwork or meditation or going for walks. It's just, so we have to, and that's why I love what I do, and that's why I'm doing what I'm doing, shouting from the rooftops. This is not difficult. It's not difficult to reduce your risk. You just have to put some basic principles at work in your life.
Breathwork oxygen is free, so we can't really monetize. Right?
Yeah, let's hope it stays free.
Are there any maybe hidden factors that are driving heart disease that maybe people aren't checking or paying attention to?
Absolutely. Yeah. And that's why I love what I do now, because I get to teach these things and I'm talking about it constantly on all of my channels. So yeah, we need to look at, there's kind of three main areas, well, four really. So our metabolic health. So how well we metabolize glucose, like are we insulin sensitive or are we insulin resistant? Inflammatory markers. So do we have widespread inflammation going on in our body that we don't really think of as inflammation, but it could be skin issues, it could be migraines, it could be joint pain, so many ways that inflammation can present, and we just don't think about it as, oh, this is also putting me at risk for heart disease. Oxidative stress. So, not having enough antioxidants circulating in our body to neutralize the oxidation that's happening in our body, and then nervous system balance. So coming back to that point of stress, I just think we are chronically stressed, but there's no pill for it, and doctors don't have time in their office to really effectively teach stress management. And I feel like stress and gut health are just two foundational principles that we can't, nothing else that we try to build on top of that is going to work if we don't manage stress, if we don't get people balanced in their nervous system, and if we don't help people establish true gut health. So, because the gut health is going to improve inflammatory issues, improve oxidative stress.
Could you take us through a new patient experience? Someone comes to you. Is it something that they've already been diagnosed with, or do you get people that say the genetic thing, I don't want to get what my grandfather had?
I mean, I wish I would have more people that would come to me, because they're worried because their parents both had heart issues. That would be great. So if anyone's listening, and that's something that you'd like to do. But I have, for cardiac health, because I kind of have two branches of my business. One is metabolic health, where I'm really working with a lot of perimenopause, menopause women and resistant weight loss issues. And then the second arm is more the cardiac. I really want to build the cardiac because of just everything that I've seen, and that whole idea that 50% of heart disease is diagnosed after sudden death. I mean, that's just scary. And the young people that I saw in cardiac rehab, so the heart patients that I have worked with, the clients that I've had, have come to me after diagnosis, after having stents placed. They're like, I don't, or an arrhythmia. I had a gentleman who was dealing with some atrial fibrillation issues. So they're coming to me because they don't want this to happen again. And they have they were disillusioned with the Band-Aid approach of Western medicine, which is really just don't get me wrong. If I'm having a heart attack, I definitely want the stent. If I'm having a heart attack, take me to the ER and put a stent in me, 100%. So, but it's not a cure. It's not addressing the root cause of heart disease. And I think that people are starting to understand that idea. So I'm putting all these medications, but let's talk about, why is my blood pressure high? Do I have to take medication the rest of my life? Is there something I can do that will reverse the high blood pressure? Is there something I can do to reverse this metabolic, insulin resistance? And that's where I come in.
You build a personalized plan with people. Are you working in lifestyle changes, supplements?
The first thing we're going to do is we're going to look at what's going on underneath the hood. I'll usually just give them a list of, here's all the tests that you should ask your doctor for. And usually the doctor will say, fine, I'll order these. I may not, counsel you on these, on what we get back, on the results, but yeah, I'll order them. Sometimes the doctors won't, so I can actually order them for the client, but they just don't get their insurance to cover it. So we get labs, and then once those come back, I help them understand. So I'm not diagnosing, I'm just educating. I'm like, okay, here's your education on what these lab values mean, and here's some education on what you can do to optimize in these areas. So I'm not diagnosing you, I'm not treating you, I'm just educating you on on what these numbers mean and lifestyle interventions that can be utilized to optimize the values. So, and those lifestyle optimization recommendations are going to be individualized to that patient or client. I have to keep saying, they're not patients anymore, they're clients. And so there are some across the board, like everybody needs to do, right? Like taking processed foods out of the diet. That's not something I tell some people and not others. Of course, like there's kind of the foundational lifestyle modifications, but then other things will be very individualized to a client's day-to-day life and schedule and goals and abilities.
When that person comes to you and maybe they bring labs or you order labs with them, when they sit down, the education you give them, is it to get a better understanding of what because a doctor like you go to in inflammation, oxidative stress, things where a traditional MD might just say, well, just stress less. And you're like, what does that mean? How do I stress less? I have like 4 kids and a job and the commute and bills and a mortgage. Right. And then inflammation. Now we can test for that, but I don't want to put this on all doctors. There's wonderful doctors out there in the traditional world, right? But on the flip side, I don't feel like they're emphasized enough in general preventive health. Why do you think that might be?
It comes back to, what are you going to do about it? And there's not really a lot of money. I mean, eating more, you're going to get hopefully more money to local farmers because hopefully you're going to buy more local organic produce. But it's like, if to build your antioxidant status, you need to eat more whole foods. You need to eat a rainbow of colors every day. You need to maybe take some supplements that are, that have some, extra antioxidant benefit. But again, there's not a lot of money in some of these things. So there's not a lot of marketing for it. So it kind of comes back to what's being presented and put in front of us. And it's really backed by who has the money to do that. And, I would love to have all the money in the world to promote what I do. But it's difficult.
I don't even think people understand when you say food desert. Could you elaborate?
People are living in places where they don't have access to local produce. I mean, they might have a few convenience stores nearby and they just don't have access to a lot of healthy whole foods readily available. It takes a lot more effort and time to secure those types of foods. So, we have to recognize that, what we might take for granted, other people are like, well, yeah, that's not so easy for me. So helping people.
They get like the pre-cut melon or something
Exactly. How long has that been cut and sitting in plastic,
What they have to spray it with to make it stay green or
exactly
whatever color.
Right, right.
Whoa.
For sure.
It's scary. I was on your website and I saw some symptoms. I think you listed symptoms like low energy, cravings, weight loss resistance, maybe like red flags out that I don't know that people would generally go to like low energy. Are there demographics, maybe age, gender, lifestyle groups that should be concerned?
So symptoms, basically any kind of chronic issue that you might be dealing with. So it could be brain fog, it could be fatigue, migraines, skin issues, high blood pressure, maybe your blood sugar is running high, just, poor levels of energy, having a lot of like afternoon fatigue, feeling like you constantly need caffeine or sugar, not sleeping well, like really restless sleep, not waking up feeling rested. There's so many things that you can attribute to metabolic dysfunction and poor gut health. So I tell people, how do you know if you have leaky gut? You have any chronic issue at all. So, we need to be aware. Our body is sometimes, I like to say, before people work with me, it's kind of like they've got duct tape over the check engine light of their body. And so they're not listening. Their body might be trying to tell them like something is off, but they're just like, they're not really paying attention. They're just like normalizing indigestion, normalizing bloating, normalizing gas, normalizing, whatever, skin issues, poor energy levels. And until the body screams, which it might end up being, the scream might be a heart attack. It might be, sudden death. Until the body screams, they're not really paying attention. So I tell people, if you're not feeling great, something's off. Like our bodies are designed to work well, and we should be able to feel great very long, very late into life. But we just start to normalize. Even in Western medicine, they talk about what's normal. Does normal mean ideal? No. I mean, we need feeling great, not just feeling okay. So the symptoms could be any of those things that I talked about. And so demographic wise, honestly, there isn't, I mean, everyone should want to know what's going on below the hood. I mean, when I had the 38-year-old, when I talked to him in more depth, he had a lot of gut stuff going on. He had a lot of issues with his gut, and he had a heart attack and a stent. So I think anyone over the age of 30 should want to know what's going on, should want to get labs and know what's happening below the hood.
What is the gut connection to heart that people just probably are not aware of?
Yeah, I love when I get to answer this because I just think there's a serious lack of awareness. So the gut is basically the barrier between the outside world and the inside of our body, right? And it's a single cell layer thick. So we need to have a nice tight gut wall. We need to have a nice intact barrier that only allows things to get through that should get through. Because the immune system is right inside the gut wall. So we've got like 78% of our immune cells are right inside the gut wall. So if the gut wall is damaged and things are getting through that shouldn't get through, the immune system is right there going on attack mode. And so when that's happening day after day after day, your immune system starts to just get overwhelmed and it starts to get confused and it starts to attack some of its own tissue. This is where autoimmunity comes in. So a lot of autoimmunity can be put into remission just by healing the gut wall and creating a more intact barrier. So when the immune system is going haywire, we end up with inflammation. Inflammation is an immune mediated thing. So the immune system is going haywire. It's starting to attack its own tissue. We start to see inflammation throughout the body. That inflammation is affecting the lining of the arteries. So between the oxidative stress, the inflammation, we're having damage to the wall of the arteries, the endothelial layer of the arteries, and then that damage is where plaque starts to accumulate. And that's where cholesterol comes into play. It's coming in to say, oh, there's been damage. I better go there and heal up that damage. And in the process of doing so, we end up with plaque buildup. So if we can heal the gut wall and calm the immune system down to where it is better regulated, then that inflammation will be eliminated.
When it comes to even foods and nutrition, like are there foods people can eat to sort of maybe tackle inflammation?
100%. Yeah. So first thing we talk about, so there's a 5R approach to healing the gut, and the first R is remove. So we got to remove the things that can be poking holes in the gut wall. So it could be food sensitivity. So some people are eating things that they have no idea that their body's actually sensitive to, and they need to get those things out. So we can do food sensitivity testing, or in the case of what it looks like when people work with me is I do put people on a little bit of a kind of a elimination diet. So we take out many of the common culprits, and in the process of doing that, they will oftentimes see a lot of changes in their body. So they'll be like, I had a guy get off of his asthma medication because he didn't have inflammation in his lungs anymore. I've had people have skin issues that cleared up. I had a guy one of my guys that I was working with for heart health, after a few weeks of working with me, his psoriasis started going away. He's like, oh my gosh, I've had this plaquey psoriasis for years, and it's almost healed. So that was like a huge side benefit. So the elimination diet oftentimes will be all that we really need to quiet down that inflammation. And then we sort of start to bring things back, and I have people really pay attention. What are you noticing when you eat this food or that food? And if they're paying attention, they might be able to then see, because we've taken the tape off the check engine light, they can actually hear their body again. And they can actually recognize the body's signs and signals. So food sensitivities, in many cases, people can be eating just processed foods filled with thickeners, fillers, emulsifiers, just garbage and processed foods that actually can cause damage and increase permeability in that gut wall. For some people, they can be gluten sensitive. Even if they're not celiac, gluten can cause problems with the integrity of the gut wall. Certain medications can cause problems. Dysbiosis, so our microbiome should be nicely balanced with a variety of different bacteria, and when that gets out of balance and we have increased levels of pathogenic bacteria, then that can also cause damage to the gut wall. So we really want to look at what's going to help balance and heal the microbiome. So there's sometimes targeted probiotic supplementation that we can do. We can bring in foods that can help heal the gut wall, and supplements that can help heal the gut wall, like L-glutamine, even just drinking bone broth, more whole foods, less processed foods. So there's a lot we can do. And then that's the good news is we can, take a gut that's been leaky for a long time, and over time we can heal it. There's other, peptide therapies that can also more quickly heal up that gut wall.
That's a great way to explain it, because I think when people hear gut brain, gut heart, gut this, gut they kind of move on. Right. And you broke that down really well for people to understand how this is all playing a role in everything, but putting in our body mostly, right?
Yeah. Oh my gosh, 100%. I mean, I'm an exercise physiologist is what my master's degree is in. Clinical exercise physiology was my previous career. And I believe that exercise enough exercise could undo a bad diet. It was the cure for everything, just exercise enough, and it doesn't matter if you don't sleep enough or you don't, eat great, just exercise, and I really believe that it was that powerful. And I have since learned that you cannot exercise your way out of a bad diet. Maybe in your 20s, maybe, but I think anymore we really need to recognize sleep and nutrition you cannot sacrifice those things and think that exercise is going to make up for it. We've got to put the right foods in. We've got to nourish our body with the right foods so that everything can function the way it's intended to, and we can live long and live well. It's like nutrition and truly like exercise as well are the keys to longevity. We've got to have muscle. We can't just sit around and think that we're going to have quality years in our later years. We've got to have muscle. We've got to do things that keep muscle, and we've got to put the right foods in that tell our cells what to do so that we can live long and well. It breaks my heart to see people in their 70s and 80s that could be still thriving, that could be still just living, like traveling, adventuring, just thriving. And they're starting to have all of these diseases of, what we call diseases of old age. But it's not age. It's just that we're not taking care of ourselves the way we need to.
You had mentioned people who maybe when you turn 30 is when you should start paying attention. What kind of like lab test, obviously like maybe a cholesterol panel or something like that, but when you're ordering lab tests for people to get maybe that picture of their heart health, even if they're 30, 40, whatever, what are you looking at?
I would want everybody to get an inflammatory marker. So an hs-CRP is kind of the most basic. So if anyone wanted to, it stands for high sensitivity, and then CRP. So CRP, I can't even remember what that long word is, but you can ask for an hs-CRP. You can ask for fasting insulin. So just knowing your fasting glucose only gives you one side of the equation of your metabolic health. You really need to know how much insulin is needed to control blood glucose. So a fasting insulin is really, really important. And a hemoglobin A1C, if your doctor's not already ordered that, to give you kind of a 12-week average of your blood sugar. You can ask for oxidized LDL to understand a little bit of your oxidative burden. You're going to want like a homocysteine as well for an inflammatory marker. And then also like an ApoB, that's going to give you a better idea. So a basic cholesterol panel, the main value of that is triglyceride. Your triglycerides are a really good indicator of your metabolic health, but you really want to get a breakdown of what's happening with your LDL, because your LDL, you could have a fine LDL, like maybe it's 80, but most of that 80 could be more pathogenic. It could be oxidized, and it could be oxidized, small particle LDL, which is it contributes much more to heart disease versus having more large, fluffy LDL. So LDL you should be able to dive a little deeper. So an ApoB tells you kind of how much of your LDL is more pathogenic. And then an LP(a), that's kind of what we're now recognizing as sort of the silent killer. LP(a) is very pathogenic. And so we need to understand if that's something we have going on.
What do you like for people when heart health focused? Because I think a lot might think cardio. I want to do treadmill. Or is it strength or a combination? Where do you guide people when it comes to the exercise component?
I think it needs to be pretty comprehensive. So we want to have flexibility too. When we lose flexibility, we have increased risk of injury and fall. So I think ideally you're able to engage in some cardio. Walking is great. Walking after meals, especially, because we can really change the way that we metabolize glucose. When we can get out for a walk after meals, we're going to have less of a rise in our blood glucose. So 10-15-minute walks 3 times a day would be really great. And then doing some kind of strength training. You don't have to go to a gym. I have in my living room behind me, I have my kettlebells and my dumbbells and my elastic bands. I can do everything I need, and then body weight. So there's a lot you can do within your own home. And like I like to talk about habit stacking for strength training. Like some people are just really resistant to strength training. So I'll be like, how can you like stack strength training with something that you already do? So maybe like before you brush your teeth or after you brush your teeth, you can do some lunges. I have a chin-up bar right next to my laundry room. So it's like every time I go through that doorway, I do a couple pull-ups. You can do squats in the kitchen while you're waiting for your coffee to brew. So I'm all about working it into your life and not making it feel like this big thing that you've got to carve out an hour for. Strength training can just be something that you do throughout the day, and you stack it with, I'm getting ready to make my lunch. I'm going to do 20 squats. I'm getting ready to head to work. I'm going to do 20 wall push-ups. I mean, just find ways to work it into your life. And if you love strength training, awesome. Go to the gym. But we got to keep our muscle. We absolutely have to maintain muscle. Walking is a great cardio. If you like other forms of cardio, great. If you like to jog, great. I'm a huge fan of getting outside. My answer for managing stress is often nature, nature, nature. Vitamin N, you've got to get out and get into nature. It balances your nervous system. You get antioxidant, anti-inflammatory benefit by being in natural spaces. So walking, especially if you can get into natural spaces, is really great. And then meditating. Cardiac wise, like we also really need to learn how to get into that parasympathetic state. And if we're always thinking we have to do and do and do and never just be, we're just gonna run ourselves ragged.
Is it a hard and fast rule for people that you kind of recommend nothing less than this, or timing of sleep? Because obviously there's some people that they work nights, they're bartenders, whatever, so they can't get to bed by 10 p.m. But is there a duration of time and a system, a pattern that they should be on if possible?
It's very individual, and we all have a different sleep chronotypes. We will all have a different time that we really should go to bed. I do think there's a circadian rhythm that we should all follow. So, living kind of in synchronicity with the rise and fall of the sun. Those are things that we should, obviously we're not going to, sleep 12 hours, in the middle of the winter, but staying up till 1 or 2 in the morning, unless you have to, because it's your job, is never a good idea. Like we do need to I tell people, 10 to 11, is really when we should all be trying to get to sleep. Some people are, they like to go to bed early, so they're going to bed at 9 or 10 or even 8, but ideally you're getting 7 to 9 hours of sleep. And again, it's that's a 2-hour range because we all need different amounts. I like using a tracker. I use an Oura ring. And so my Oura ring will give me a sleep score, and it'll tell me how much REM I'm getting, how much deep, how much overall sleep, how restless I was. It'll also tell me my heart rate variability, which is a really good indicator of nervous system balance and health. And so Oura Ring, Whoop bands are also good for those kinds of metrics. So just dialing in. I think the Apple Watch is pretty highly rated for sleep metrics. But I think a lot of the smart watches that do like a million different things, you kind of have to be careful trusting all of those health metrics, and getting something that's really more designed just to be for health metrics might be worth looking into.
So you like the tech, but some of them are just doing way too much that you don't really need, kind of thing, and more focused, I guess, devices people should be looking for?
Like Garmin and Apple do an okay job with some of their health metrics. But the ones that they're also doing so many other things, right? They're smartwatches. They're telling you your email and your texts, and they're playing music, and they're GPS. Like they're doing a lot, and they're not necessarily going to be the most accurate in terms of just the health metrics that we're looking for. So if you really want to know your health metrics, then an Oura Ring, a Whoop band, there's probably other ones out there that are new that I don't know about, then those are going to give you, and again, the HRV, like HRV, heart rate variability, is a really strong indicator of nervous system balance. And I've been studying this. I was studying it for the last couple of decades when I worked in cardiac rehab, about how closely linked HRV is to cardiovascular risk. And so that's one of my main things that I look at every morning is my HRV, and looking at how like my choices the day before affect my HRV. So a glass of wine, my HRV is going to be lower. So it's a really good reminder of why I don't drink a glass of wine every day. Too much exercise, my HRV is going to be lower. So it's also a good reminder, like you can't just go out and crush it all the time. Like that, there's a price. You have to also balance rest. And so there's lots of things we can gain from those wearables, but not to fixate on them, not to get like hyper fixated and obsessive.
What do you recommend for people for resting? Is it a day you think people should just once a week?
I think it just really depends on what they're doing. I mean, athletes that are out there, really just like doing huge things. I'm an ultra trail runner, so I have to be really careful knowing like, okay, if I did a long day of running in the woods, then I need to be okay with a day of mostly rest. But, you also have to build in strength training. And so this is where working with, I mean, if someone's out there working at this level, I think working with, at least initially working with a trainer to help them understand, how they should be pushing. I mean, I'm 54, so I have to factor in rest more than I would have to in my early 40s. So it's just also age dependent. Like you need to have more rest. You can still crush it, in those later years, but you have to balance it with more rest. So it's kind of a very individual question. But I think it's just important to know we need rest.
For someone who's interested like in learning more about what you do, specifically working with you, you bring all this together for people and then get them on that plan on how to optimize life and health?
We start with checking what's going on, educating them about what we're seeing, educating them about what they need to do in their lifestyle to optimize all of those areas: metabolic health, oxidative health, nervous system balance, inflammation. And then, I work with people based on what their own goals are, based on the science behind longevity. So, it's just really important to me that they're learning everything that they can about how to have the best longevity and, brain health, heart health, nervous system health, muscle health, joint health, and all of those things. The beauty about what I do, which I love so much, is that the same approach that we take to help reduce cardiovascular risk is going to reduce risk of cognitive decline, it's going to reduce risk of arthritis, it's going to reduce risk of pretty much every other chronic issue. And so it's just like, oh my gosh, like it's so much bang for the buck, right?
What's the best place like to get in touch with you to work with you? Do you work with people across the country or around the world?
So I work remote. I do, like, people who are local to my area, a lot of times they prefer to meet in person, so that's fine. I always enjoy getting out. But I work remote. I see people all over the world, and so I do remote coaching sessions with people. I also have hybrid programs that are group and one-on-one. So I do have a community, which is really great, and we do group coaching every week. So when people join different ones of different packages that I offer, then they may be in that group coaching situation as well. Yeah, I'm on, they can find me on heartwellnesscoaching.com, and then I'm either Heart Wellness Coaching or Heart Wellness Coach, depending on what channel.
Jumping into that was very informative, and I know people listening will gain a lot from that. Heartwellnesscoaching.com is the website. Thank you for your time today.
Thank you so much for having me. It's been great.